Hi, my name is Brandi Bryant, and I am living with lung cancer. Thank you for taking the time to watch the Lung Cancer Foundation of America's Hope with Answers videos. You've come to the perfect place to learn more from expert patient advocates and dedicated doctors and researchers. Please like, subscribe, and share this video with anyone you know who wants to learn more about living with lung cancer. Hi, my name is Brandi Bryant, and I'm a lung cancer patient. Today I'm joined with Dr. Raymond Osarogiagbon to talk about caregiving. Welcome. May I call you Ray?
Please do.
All right. So research has shown that caregivers often experience isolation and loneliness. What advice do you have for caregivers who are dedicated and the only ones to help with their loved one?
Yeah, caregiving is a tremendous burden which has been understudied. Caregivers oftentimes get ignored, left behind, and it's only now we're beginning to appreciate the fact that they suffer too. And yes, indeed, caregiving is a tireless, tiresome task. It's a sometimes thankless task, and it can be a lonely task, obviously emotionally taxing as well. And caregivers also have the challenge of sometimes having to provide economic support in the midst of a catastrophic illness for their loved one. So one of the things that we are saying is, number one, we need to pay more attention to caregivers and their struggles and their needs. We also need to communicate with them directly, help them understand what's going on, what's coming around the corner maybe, and also encourage them to seek support. Nobody deserves lung cancer, and certainly nobody deserves to feel alone in supporting a loved one with lung cancer. So we ask caregivers to find a network. There are all kinds of cancer support networks with people who have experienced the same thing in different phases. Some are survivors, caregivers of survivors. Some have the experience of what happened even when they lost their loved ones. That support network is there to be plugged into. We also encourage, especially African Americans, who sometimes want to bear a burden alone, and because of all the stigma and some of the nihilism that goes with lung cancer, don't feel comfortable sharing their burden with others. We actually strongly encourage that people share the load.
Yeah, it's okay to admit that you're struggling.
Yes.
So yeah, that is great advice. So that's what you would advise to caregivers who might not have family and friends around, that there are support groups available and resources out there for them. What about those caregivers who are working while also caregiving, trying to juggle maybe a very demanding job and also care for their loved one in the best way possible?
Yes, that's one of the tragedies of our modern time too, that because healthcare is so much more dependent on employment in America. When you're struck with a devastating illness, right when you need it the most, sometimes is when your healthcare support, your insurance support can, falter and fail you. So we encourage that people discuss the situation with their employers. Oftentimes, they're human resource approaches that can, help, defray some of the financial burdens that you have. We also encourage, again, that people plug themselves into networks of advice that can tell you, because your experience is not unique. There are others who have learned and who have found solutions. And sometimes just sharing the burden, just talking about it. I'm struggling financially. Oh, the one who's sick is the one who supports the family financially. Or yes, I'm the one supporting the family financially, but I'm having to take more time away from work to provide care. Talking about this with your clinicians, because there are social workers in healthcare systems and clinics who are actually trained to know what kinds of resources there are out there to support us. Talk to your care providers, the clinicians. Talk to your insurance provider. Talk to your human resources people at work, and talk to your social network as well. You never know where the solutions will come from.
Yes,
So
yes.
ask.
Yeah, that'll be great help, and then you're not feeling completely alone.
Yeah.
Thank you so much, Ray, for that great advice for caregivers, and thank you for joining us for Hope with Answers.